Hey everyone! Today I'm going to take you through a fascinating journey into the world of medical imaging, specifically focusing on how tuberculosis, or TB, appears on chest X-rays. Tuberculosis is a serious infectious disease that primarily affects the lungs, and it's vital for medical students like you to understand how to identify it in X-ray images. This is crucial for diagnosing TB accurately in clinical settings. Let's start with the basics. When looking at a chest X-ray of a patient suspected of having TB, there are several key features to look for. The most common is the presence of infiltrates or shadows, which are usually seen in the upper lobes of the lungs. You might also notice cavities, which are hollow air-filled spaces within the lung tissue. These cavities can sometimes be quite large, and they are a hallmark of pulmonary tuberculosis. Another important sign to look for is the pattern of these markings. TB typically presents with a nodular pattern, which means you'll see small round spots scattered across the lung fields. Now let's zoom in on one specific X-ray image. Here you can see a dense shadow in the right upper lobe of the lung. This shadowing is indicative of a consolidation where the alveoli, which are tiny air sacs in the lungs, fill with fluid or infectious material. It's also essential to consider the patient's clinical history and other symptoms, such as weight loss, fever, and persistent cough, when interpreting these images. This comprehensive approach ensures a more accurate diagnosis. In your future careers as healthcare providers, being adept at reading these signs on an X-ray will be invaluable. Not only will it aid in the timely and correct treatment of TB, but it will also help in preventing its spread, considering how contagious the disease can be. So, keep practicing, keep learning, and remember, every X-ray tells a story. Understanding that story through images is a powerful tool in medical diagnostics. Thank you for joining me in this educational journey. Stay curious and, most importantly, stay dedicated to making a difference in your patients' lives. See you next time.